Thank you very much, Jennifer, for the introduction. Thank you, Rosa, as well, for the kind words before. I am delighted to be here, so before I get started, I would like to thank Purina as well for inviting me to attend this workshop and having the opportunity to deliver this talk on how we can assess stress and anxiety in dogs. So my specific objectives today are three. First, I would like to discuss some of the difficulties we encounter when we want to assess stress and anxiety. Secondly, I would like to describe some of the tools that we can use to do that, to assess stress, despite the difficulties. And finally, my third objective is to illustrate why I think it's so important to look beyond dogs when we want to learn about dogs. So why the comparative approach is so important. So difficulties, tools, this comparative approach. And this is the plan of the talk. I would like to start with some general principles, some fundamental issues when we assess stress. Then I will touch upon some of the practical difficulties very briefly. And then I will spend most of my time looking at tools to assess both acute and chronic stress. And finally, I will end up with a summary and a few concluding remarks. Okay, so general principles. Sarah already discussed the concept of stress very well. So let me build on that to illustrate some of the challenges we encounter when assessing stress in dogs. Now, this could be a classical definition of stress in a physiology textbook. So we think of stress as being a response that includes physiological and behavioral changes, and that response that we call stress appears when the animal faces a threat or a challenge. The problem here is that the threat can be a threat to survival. That's the easy one, but can be a threat as well to homeostasis. For example, running for fun, for the joy of it, can be a threat to homeostasis. Glucose can go down, body temperature can go up, so it's a challenge, it's a threat to homeostasis, and because of that, the animal will start with that stress response. And that difficulty becomes very clear when we look at physiological markers of stress, which are possible tools to assess stress in dogs. For example, cortisol. Cortisol has been the subject of many, many studies, and it is common in the literature that we equal high cortisol with stress. And that, in theory, is okay, but in a practical context, when we are concerned about animal health and animal welfare, that can be very misleading indeed. The reason is that if you took a sample of the dogs on the left, you would find an increase in cortisol, very likely, which is fine. However, if you took a sample from the dogs on the right, you will find as well an increase in cortisol. And yet, the dogs on the left may be facing a welfare issue, perhaps. There is no reason to believe that the dogs on the right are facing a welfare issue as well. The reason for that is relevant not only when it comes to cortisol, but when it comes to the vast majority of physiological indicators of stress. And the theory behind it has been very well explained, this model by British colleagues at Bristol University. So the emotional status of an animal can be described using the arousal of the animal and the valence of the emotion. Valence being either positive, so pleasant, or negative, so unpleasant. And the thing is that cortisol and many physiological markers of stress will measure one of these dimensions, which is arousal. So if you have high cortisol, you can conclude that the arousal is high, but this high arousal, as you can see here, can go hand in hand with a negative valence, so you would have a possible welfare problem, but it can go together with a positive valence as well. So high cortisol will not necessarily allow you to conclude that there is a stress problem if we define stress as something with a negative connotation, a welfare problem. So because of all these difficulties, some people in the welfare literature have moved away from the classical definition of stress that we find in physiology textbooks and define stress as an emotional response with a high arousal and a negative valence, which will appear when animals encounter a situation which overtaxes their coping ability and which is unpleasant. So intense fear and maladaptive anxiety will fall into this situation. Now, to finish with this, just an important remark. You see high arousal there, but please beware that high arousal does not equal to intense physical activity. So you can have a highly aroused dog which is feeling a negative valence emotion, and yet the dog is not showing at all intense physical activity. And I think that's something we have to remind our colleagues once and again, because it is common for people, even vets sometimes, to misinterpret the fact that a dog is doing nothing, apparently, with the fact that that dog is feeling well. So there are two different things altogether. So in summary then, when we want to assess stress in dogs, we can have, broadly speaking, three different tools. We can look at physiological changes. Those are mainly used in research, and you have a list there which is far from being comprehensive. But remember that if we do that, we have this risk of measuring arousal rather than valence. And then we could use behavioral changes, including assessment scales, and we have a promising tool there, which is the use of facial expressions, which I will touch upon very briefly later on. So, okay, so far the fundamental principles that already tell us that assessing stress is fraught with difficulties. But beyond those fundamental difficulties, we have as well some practical issues when we want to assess stress and anxiety based on scientific evidence. So to start with, some signs of stress can be very subtle, and I will develop this later, because clearly when a dog is very, very stressed, recognizing that can be perhaps easier. But it is probably too late. When we want to identify mild stress, then very often we rely on very subtle signs, which by definition are more difficult to identify. Not only that, some of those behavioral cues are unspecific, meaning that they will appear when there is stress, but they may appear as well in other context. So we have to distinguish that. And finally, and I would like to spend a couple of minutes with this third issue, some people may have difficulties to read the body language of the animals, to interpret what is the message they are trying to convey. And there is this very interesting study done with vet students in a vet school in Spain. They sort of tried to rank the ability of different of the vet students to identify stress in dogs. And the authors found that there were two main factors explaining variability across students. One was whether those students had been exposed to a sound training in stress, even if that was theoretical training. That meant a difference. So good scientific skills on the basis of stress physiology help. The other thing, which to me is probably more telling in practice, is that students with a history of pet ownership were better at identifying stress in dogs than students without history of pet ownership. That sounds very logical, and you probably could have predicted that. The interesting thing is the discussion in the paper, because the authors suggest that there might be two explanations for that effect of pet ownership history. One is perhaps the most obvious one. If you live with an animal, you get familiar with the animal behavior, and you are better at identifying signs of stress. That's fair. But the other thing is that, and to me that becomes very interesting, is that we know that it might be a link between pet ownership and being empathic with animals, empathy. And we have at least anecdotal evidence suggesting that people, even colleagues which are very good from a technical standpoint, but perhaps are not terribly empathetic with animals, have more difficulties at identifying signs of stress. So part of the difficulties fall on the human side, and they have to do not only with practical knowledge, which is obviously important, but also with theoretical, fundamental knowledge and something perhaps less tangible, which is being empathic towards animals. Okay, and just on top of all that, and Sarah already explained it very well, we have the fact that not all dogs express stress in the same way. It depends on the age, the temperament, and the temperament in turn depends on genetics and early environment, the context, and we will go back to that. So we may think that signs of stress will be the same regardless of the stimuli, and that is not true. It may change, particularly when there are social context-related issues, and finally, the dog previous experience with the situation. So we have the fact that signs of stress can be subtle and not always specific. We have the issue of variability across dogs. And finally, we have the issue that people, for different reasons, may differ in their ability to identify stress signs. Okay, but nevertheless, we have tools to assess stress in dogs. And now I like to discuss some of the tools, the signs we can use in practice to identify first acute stress, then chronic stress. So let's start with acute stress. For example, stress in a clinical setting during the visit to the vet, or stress when the dog is exposed to intense sounds, for example, right? As stress includes a set of changes, many different changes, you may think, and you would be right, that the ideal approach would be to have a scale of stress, because that scale would combine different informations, different signs. And that's fine, in theory. The only thing is that when in animal welfare we use scales, we have to be sure that those scales are reliable, valid, and feasible. Now, I don't have time to go through the concept of validity and reliability and so on, but to make a long story short, when we say reliable, we mean that the outcome is consistent. When we say valid, we mean that we are measuring what we think we are measuring and not something different. And we say feasible, we mean that that is doable in practical situations. Now, we have two questions here. First, do we have scales to measure acute stress in dogs? And second, if the answer to the previous question is yes, are those scales reliable, valid, and feasible? Well, the answer to the first question is yes, indeed. We do have some scales. This is probably the best known of those scales, the spectrum of fear, anxiety, and stress developed by Fear Free. Probably many of you are familiar with it. It is meant to identify and assess the intensity of the stress and fear response of the animal in the clinical setting. And it goes from mild, subtle signs of stress up to severe signs, which can be related to a flight response or to a fight response. So it looks good. The question is, do we have any evidence that this is reliable and valid? And the answer, I think, is to some extent, yes. And I would like to draw your attention to this paper, which is a rather recent one, which addressed this question, whether the fear and anxiety spectrum is reliable and valid. And the authors did several things. They look at reliability, both inter and intra-rater reliability. As you can see, the results were excellent or very good, so apparently the scale is reliable. And as for validity, what they did was to see whether the outcome of this scale is highly correlated with another scale I will describe right now. And the answer was yes. There is a strong correlation between the two scales, which add some support to the hypothesis that they are valid, that they are measuring what we think they are measuring. So the conclusion of this paper was that the spectrum of fear, anxiety, and stress is a valid and reliable tool for evaluating acute stress in dogs visiting the veterinary practice. Nevertheless, the same authors raise several issues about the use of the scale and several limitations. But the scale is there, it is potentially useful, and we have some evidence showing that it is reliable, and to some extent, we can say that it is valid. Now, the second scale I would like to mention is the Lincoln Canine Anxiety Scale. The history of this one is different. It was not developed to assess stress in the veterinary practice. It was developed to assess stress in response to sounds, to noises. Now, the scale includes 16 items. Each of them is ranked from 0 up to 5, and then you get an overall score for the scale. Again, is it reliable? Is it valid? Well, to some extent, we can say yes, it is. Now, we have that it has a good internal consistency. That means that when they run a principal component analysis, they concluded that the scale is measuring one thing, not different things altogether. That's good news. They saw that each individual item is correlated with the overall score, which is as well a sign of internal coherence. And when they ran the scale with a control and a treatment group, the treatment group being dogs exposed to intense noises, they did find that the scale was able to to tell the difference. As for feasibility, one important thing is that the same authors suggest that even though the scale was initially developed with 16 items, if we use 11 of them, the results can be very good still. So we have another example, a second one of a scale which is potentially useful. However, the fact is that very often we don't use these complete scales. We rely on single behaviors. For whatever reason, lack of time, lack of training with the use of scales, or whatever. And we expect that by looking at one particular behavior, we can draw conclusions about the stress or anxiety of the animal. And in those different behaviors we can think of, as I said before, we have some which are very apparent, very dramatic if you want, and then there is not much discussion perhaps, but then we have the more subtle ones, which are particularly useful because if they were valid and reliable, they would tell us when the dog is experiencing mild stress and we could do something about it. And among these subtle behavioral signs, I got very interested in these displacement behaviors. The concept displacement behavior is a concept that comes from classical ethology and psychology. Basically, is something that animals, including human animals, do when in a conflict situation. And that thing that we do bears no relationship or coherence with the context itself, right? So it has been suggested that these displacement behaviors can be byproducts of stress, and in dogs we have very many. Some of them are self-oriented, some of them are directed towards the environment. Now, of course, I don't have time to go through all these displacement behaviors, but there are two which I think are very attractive and useful to make the point I want to make. And those are lip licking and yawning. Now, if you look at internet pages or even serious literature, you would find hundreds or thousands of references to the potential use of lip licking and yawning as subtle signs of stress. But again, we have to ask whether this is based on a valid assumption. So the question is, what do we know about lip licking in dogs as a sign of stress? What is the science behind it? Do we have any evidence? Well, I show you 3 studies. This is the first one, 2018, and a study done with puppies, defined as dogs younger than 6 months of age. And they were exposed to fearful, non-social stimuli. Remember that, non-social. And as you can see, lip licking was not a sign of fear or stress in those puppies. No use at all, according to this study, of lip licking. Now, 2 possible explanations for this. It might be an age thing, maybe puppies don't do it, or it can be related to the nature of the stimulus. Now, let's move to the next paper. This one is with adult dogs, and they were exposed to 3 different types of stimuli. Social one, human faces, either happy or unhappy faces. Second one, social as well, dog faces, either happy or unhappy dog faces. And finally, non-social stimuli, noises, auditory stimuli. And the outcome of the paper was, first, lip licking did not appear at all when the stressful stimulus was non-social. When it was social, it did appear, but dogs were much more likely to show it when the social stimulus was related to humans rather than to dogs. So if we put together the two papers, things perhaps start making some sense. So lip licking may have something to do with an stress response, but clearly whether or not it appears, depends on the nature of the stressful stimulus. And there is an additional complexity here if we look at this last paper. Again, they use a social stimulus, and lip licking did appear, but it appeared more or less depending on how the dog reacted to that stimulus. So if the dog reacted aggressively to that stimulus, the lip licking did not appear. If the dog reacted in a non-aggressive manner, then the lip licking did appear. So altogether, this would suggest that, I'm not saying at all that lip licking is not useful. It might be useful, but it has two problems, one of sensitivity, one of specificity. It does appear in some stressful contexts, mainly social, and it appears when the dogs respond with a particular manner to those stressful stimuli. So the lack of this behavior doesn't tell much, and the fact that it appears has to do more with how the dog reacts or wants to react to that than with the nature of the stimulus itself. Now, the other displacement behavior, which I think is particularly interesting, is yawning. And we do have some studies showing that yawning in dogs may increase when dogs are exposed to a stressful situation. But again, beware of that, because yawning can be caused by many other contexts. I mean, I see yawning often when I deliver a lecture to my students. And that might be a stress, it could be, but even in my most optimistic days, I cannot avoid thinking of other alternative explanations. But apart from boredom and stress, we do have another very interesting possible motivation for yawning, which is, again, related to social behavior. And we know that in many species we have what is called social or contagious yawning. It has been described in dogs. We don't know exactly yet what is the physiological basis for that, oxytocin, empathy, and so on, but it at least points to the fact that when we see yawning, we may or may not be seeing a stress response. Again, is modified by the social relationship between the dog and the people present in the context. So, in summary, these subtle behaviors are potentially useful, but clearly, for all the reasons I have explained, should never be used on their own, because they have problems of specificity and sensitivity. Okay, and finally, before I move to chronic stress, we shouldn't forget about facial expressions as a tool to identify stress and fear and anxiety in dogs. I think that everybody familiar with the animal welfare literature knows that facial expressions can be extremely useful, for example, to identify pain in a variety of species, and we do have some papers that suggest that facial expressions can be useful to identify stress and fear in dogs. However, please remember that the extreme variability, morphological variability of dog heads and faces would make this probably more challenging than when used in other species. Okay, so far acute stress. Now I'm going to move briefly to chronic stress. Now I am not thinking about the visit to the vet. I am not thinking about dogs being exposed to loud noises. I am thinking, for example, about chronic stress caused by poor housing or poor husbandry. And in this context, I think it is very useful to use that multidisciplinary or comparative approach, and remember that chronic stress is strongly linked to poor welfare. Many welfare problems lead to a chronic stress response, and chronic stress response, for the reasons that Sarah has explained, will lead to welfare problems in the physical and the emotional or mental domain. So I think that a very good first approach to assess chronic stress in dogs related to housing or husbandry is to use the approach that has been suggested to assess welfare in other animals, because many of the welfare problems that we can identify are going to be related to chronic stress. And these welfare assessment tools should include both animal-based and environment-based indicators. And this is probably the structure of the welfare assessment tools with a highest consensus among welfare scientists. It is based in the 5 domains principle suggested by Mellor and colleagues. And of those 5 domains, there are 4 which are the physical or measurable domains, which are nutrition, environment, health, and behavior. And for each of those, we, mainly people working with farm animal welfare, have suggested several criteria, up to a total of 12. Well, this approach has been used as well to assess chronic stress welfare problems in dogs in shelters, for example. And that is potentially useful. But again, oftentimes we don't use these comprehensive tools, and once more, we want to rely on some specific behavioral markers of chronic stress. And then the question is, do we have any of those behavioral markers which are useful for chronic stress? And the answer is probably yes. And the one that has received the most attention is pacing as an example of abnormal repetitive behaviors. What we used to call in the animal welfare literature stereotypies, and now we prefer to call abnormal repetitive behaviors. So we do have that they may indicate chronic stress. However, they do have a number of constraints and limitations, one being that they can be coping mechanisms, perhaps, and they can become independent of environmental conditions. They can be fixed in the brain of the animal, if you want. So again, we have to be cautious. And the other thing, which I believe is rather interesting, I mean, we have this classical paper by Berda, a Dutch colleague, who was one of the first looking at the stress in dogs. And as you can see, pacing does not appear in basal conditions when dogs are under chronic stress. For pacing to appear, we have to have chronic stress, and on top of that, an episode of acute stress. So still useful, but with some constraints and limitations. And just one last idea before the concluding remarks. Remember this slide. High arousal, which is not equivalent to activity, but still high arousal. The question is, could it be that very long, intense chronic stress leads to a condition in which high arousal is not present anymore? And I found that a fascinating question, and this paper in particular, I think is a very good paper, looking at whether we do have scientific evidence of depressive-like states in some mammals. Now, the paper doesn't look at dogs, it looks at non-human primates, horses, elephants, marine mammals. All of them are social. Dogs are social as well. So I think many of the ideas of this paper are applicable to dogs. And the main idea is that, yes, very likely, long, intense, chronic stress could lead to a sort of depressive-like state where perhaps we don't see that high arousal. So the absence of high arousal would not necessarily be good news when it comes to chronic stress. And this leads me to the summary and concluding remarks. A few ideas. Remember, stress can be defined in an animal welfare context as this emotional reaction with usually high arousal and negative valence. It can be identified through behavior and physiological markers, but remember the difficulties of physiological markers, the difficulties caused by the fact that some signs are subtle and the fact that some people, perhaps because of lack of knowledge or lack of empathy, may have problems at diagnosing that. And then remember there are at least 2 scales for which we have some evidence of reliability and validity. Displacement behaviors, potentially useful, but remember some constraints and limitations, and the possibility to use the 5 domains model in cases of chronic stress, and finally, the fact that recent evidence suggests that long, intense chronic stress may lead to a depressive-like state, which will not go together, perhaps with a high arousal. And that's all from me. Thank you very much again.
Thanks a lot, Xavier. Thanks a lot for this very insightful presentation. Now you will see why he was one of the best professors, right, in the university. So now we are all together. Okay, and now it arrives a moment, I have to say, that it's one of my favorite ones when we have these kind of symposiums, because we always see the human medicine, no? And many times as well we get inspired by this human medicine. And today, indeed, we are going to get inspired as well by a really good professional. Today we are living as well in a society, right, that just having some time to be relaxed and think on yourself is kind of almost a dream, right? And if you have kids, then it's impossible. Don't try it. It's dangerous sometimes. No, I'm joking. But then as well, when you find someone that is patient as well, it's like, okay, you take it like as well a big treasure. So we are really in a society where self-exigency, it's kind of the mantra, and we are all there, right? So I think that the stress is going really far, and somehow we need as well to see how we cope with that. And I think that the next speaker will help us, first of all, to see how we experience this stress, and then to see as well how we can manage it. For this, we have Laura Rojas. I have to say that I tried to just make it shorter, the bio, but it was so interesting that I couldn't, so I will just go with that. So Laura Rojas Marcos is PhD in clinical and health psychology, psychotherapist, researcher, speaker, lecturer, and author. She was born in New York, where she trained and worked in psychology and social work across various institutions and healthcare centers. She is currently a member of the Royal European Academy of Doctors, the European Federation of Psychologists Association, and the Spanish Association of Positive Psychology. Through her professional career, she volunteered with Red Cross, providing psychological support to the victims of the September 11th attacks on the Twin Towers. And among her published works are The Fields of Guilt, Speaking and Learning, and The Family. And she's recognized as one of the 100 most influential Spanish women. So we are really, really lucky to have her today. And please join me to make a big applause for Laura for welcoming her.